Hello and welcome to this KATV Town Hall event. I'm Chris May, and however you're watching us today, whether on KATV.com or the KATV YouTube channel, we are glad to have you. The month of September is coming to a close, and with it ends National Suicide Prevention Month. But this is a topic that is too important to limit to a date on a calendar. When it comes to suicide prevention, there is so much to know. The signs and causes, how best to reach out to those who are struggling, and how they can get the help they need. According to the Arkansas Department of Health, suicide is the leading cause of violent death in our state. In fact, in 2021 alone, 617 Arkansans died by suicide. The facts are clear. Not every journey is easy. For many, it's difficult to talk about feelings or ask for help. But there are organizations across our state that are providing resources to those who need them. Channel 7's Ashley Lunningham spoke with a few of them about their efforts towards suicide prevention and awareness.
Chris, according to the American Foundation for Suicide Prevention, suicides have increased in the past few years, but they tell me getting help starts with a conversation. Over 45,000 people died by suicide in 2020, and in 2021, that increased to 48,000 in the U.S. The AFSP's campaign, Talk Away the Darkness, shows the first step in suicide prevention, a conversation.
The minute that the daughter says, are you thinking about suicide? And he's able to say, yes, I'm struggling, a light comes on. And so the concept behind this whole campaign is that the first step to preventing suicide is talking.
Jacqueline Sharp with the AFSP Arkansas chapter says it might seem scary to ask this question. Says their research has shown that asking a loved one if they are okay, or even directly asking them if they are having thoughts of suicide, can give them the opportunity to speak out. Individuals who have previously attempted or who struggle with suicidal thoughts, they have indicated that it's relieving when someone else cares enough to ask that hard question. And then if they're not thinking about it, they know that you care enough to ask that. Megan Miller with the Bridgeway says there are resources available to get your loved one help. They can call the 988 National Suicide Prevention Lifeline, connecting them with resources nearby, or
you could go to any ER in your community, or you could walk straight into a behavioral health hospital like the Bridgeway. We're open 24/7, and we have people available to walk you through our process on the phone, or just walk in like it's an ER, and we can help triage those things for you.
Miller says sometimes it is the opportunity for your loved one to talk about what they are feeling that opens the door to a path of recovery.
You had seen that change in the behaviors and been willing to open up and have that vulnerable and difficult conversation. And you're the one that convinced them that there is opportunities out there to get help and really start that recovery.
Miller says Rivendell Behavioral and Pinnacle Point Hospital are other facilities in Central Arkansas that provide help to those in need. On your side, I'm Ashley Lunningham.
Okay, Ashley, thanks so much for that. We do want to remind you, if you or a loved one is in crisis, you can call, text, or chat with the Suicide and Crisis Lifeline. It's an easy number to remember. It's 988. You can also contact the Crisis Text Line. All you have to do is text the word TALK to 741-741. The 988 Lifeline does have options specifically for veterans and others for those who are part of the LGBTQ+ community. Well, now to our guests who are joining us here in the studio today, all of whom are on the front lines of the effort to prevent suicide. On the end, Dr. Chris Jackson is the branch director for the nonprofit Birch Tree Community, which provides therapeutic community services and residential options for adults who are diagnosed with a serious mental illness. You just saw her in Ashley's story. Jacqueline Sharp is the area director for the American Foundation for Suicide Prevention. And closest to me here on the stage is Buster Lackey, the executive director of the National Alliance on Mental Illness here in Arkansas, known as NAMI. And we thank you all for being with us today. It's great to see you. I think the most important thing to do when you know someone is struggling is to reach out and start a conversation. But the reality is, for a lot of people, it's not an easy thing to do. We're afraid we're going to say the wrong thing or do the wrong thing. I even felt a little bit of uncertainty about how to start this conversation about this topic. And it occurred to me that maybe the best way to do it is just to ask each of you, as professionals, How would you start a conversation either with someone or about someone that you know is struggling? And Dr. Jackson, why don't we start with you?
Sure. Well, I think for someone who's struggling with suicidal thinking, the best thing to do is to validate the feelings that are coming to the forefront. So you talk with them about what they're feeling, you talk with them about why they may be feeling those things, and then you ask the question, are you thinking about ending your life? Are you thinking about killing yourself? And a lot of times that question can bring relief or turn the light on, like in our video. So I think that validating those feelings and not shying away from that discussion is really important.
Yeah. Jacqueline, being direct is the best approach.
Yes, so we educate people that asking directly is really, really critical. The other thing I would say is you need to be listening more than you're talking. And as somebody that supported a family member that struggles, I've asked. And then the next step is knowing what to do when someone says no, because you can then say, okay, as I start to see behavior changes in you, moving forward, what are some things I can do to help you stay safe? What are some things we can set up to, if you are really struggling, that you can let me know so I can help you? And then also if they say yes, what are your next steps in making sure that you keep them safe? So yeah, I think it's just having an open, honest conversation, being direct, and listen more than you talk.
Dr. Lackey?
Yeah, I think, sometimes and I hear this all the time, if I talk about suicide or I bring the word suicide up, they're going to commit suicide.
Right.
That's just not true. We have to be comfortable with like they've mentioned, just be direct and talk about it. Ask the question. They're going to say yes or no, and then we know where we go from there. And sometimes when we're not talking but listening, we pick up more what they're saying than when they're actually talking. So I think sometimes when we get right down to it, it's all about building that relationship with people so that we know there's something wrong, so we can go to them and say something's not right here.
Before we really dive into the meat of the subject matter, I wanted to give each of you a chance to tell our audience a little bit about your organizations and what it is you do, so they have that background. Dr. Jackson, Dr. Lackey, tell us about NAMI, if you will.
So NAMI is the National Alliance on Mental Illness, and so for in Arkansas, we have 6 chapters around the state, and we provide education, advocacy, and support for people with mental health issues or their family members. A lot of times we get the call from someone saying, hey, I've got a 22-year-old, and we don't know what this is. We was told he has bipolar or something. So our staff is able to come alongside of the family, provide resources and support groups around the state so that they can learn and feel like they're not alone.
Okay. Jacqueline, tell us about the work of the American Foundation for Suicide Prevention.
Yes, so we're the Arkansas chapter. It's a national organization with 76 chapters all across the nation. And the heart of AFSP is we do research for suicide prevention. We're the largest private funder of suicide research globally. And so that research informs our prevention education. We go out to the communities and provide prevention education from 3rd grade all the way through college, and then also churches, community groups, and just the community in general. We do advocacy, so we educate legislators on suicide prevention and the importance of passing legislation that will help mental health and help suicide prevention. We do events, and then we also do our research within the area as well.
Okay, and Birch Tree Communities is your organization. Dr. Jackson, tell us about that.
Birch Tree Communities is a recovery organization. We work primarily with adults with serious mental illness like schizophrenia, schizoaffective disorder. Most of the time we get people that come straight out of the hospital after a mental health crisis. This might be a suicide attempt or something that might be precipitating a suicide attempt, and then we work with them until they're ready to regain their life or they're ready to move out into the community. And go ahead.
Okay. Well, thank you all for all your hard work. We know how important it is. Jacqueline, suicide is the outcome of a mental health condition along with other stressors in someone's life, but it is an outcome that can be avoided, correct?
Correct. Yeah, we go out and educate people that suicide is preventable, but it's important to know and to realize that somebody that's in suicidal crisis, you may see that maybe they were bullied or different things going on in their life, but what we're finding through research is that's not always the main thing that may encourage somebody or may have somebody thinking about suicide. It is complex, and there are different things that converge to a point of crisis that can put somebody into that suicidal crisis state.
Dr. Blackie, most people who do actively manage their mental health conditions do go on to engage in life. So I suppose you can't emphasize enough the importance of someone seeking out help when they're in trouble.
Right. It's okay not to be okay.
Yeah.
But we got to reach out and get that help we need, and not worry about the stigma attached to it. And that's where part of what NAMI's been doing the last 2 years is working real hard to end the stigma in our schools and end the stigma in the workplace. And I think once we can get everybody on the same page that it's okay not to be okay, we just need to get you the help that you need. Part of this problem will be under control.
I guess one of the biggest challenges is recognizing when someone is in that deep distress and in need of help, because we're all sad at different points in our life, but I guess it's when the sadness doesn't go away, that's when action needs to be taken, right?
Sure, there's plenty of risk factors that are associated with suicidal ideation. We mentioned some of them already. A lot of them are things that may not be able to be changed, but getting the help is a good way to work through some of those risk factors for yourself and be able to either change what you can change or change how you're thinking about the ones that can't be changed. And that plays a big role in building hope and building resiliency.
You mentioned risk factors. Let's talk about some of those, and we can put some of them up on our screen for you right now. Mental health conditions in particular. The big one, of course, is depression, substance use problems, bipolar disorder, and schizophrenia are among those as well. Depression, probably the most common associated with suicide, but it's also one that I imagine mostly goes undetected and untreated, and that can be a big problem.
There's 49 million people in the United States has major depression, and a large percentage of those will commit suicide. So it's important to get the word out that, again, it's okay not to be okay. Let's get you the help.
Substance abuse, also a big problem, but one that can also go undetected, Jacqueline?
Yeah, absolutely a big problem. And, as somebody that I have my own personal lived experience with postpartum depression, and that's when I think that is one of those kind of silent, there's a lot of shame, there's a lot of stigma attached to it. And so I think that might be one that, could highlight that it's one that kind of goes under the current where people don't see it or people have a hard time talking about it.
Right, and I know that some topics that you really deal with a lot at Birch Trees, Dr. Jackson, is things like bipolar disorder and schizophrenia, schizoaffective disorder. Diagnosing those conditions, I know, a priority for you.
Yes, for sure. And by the time that most of our folks come to us, they have been dealing with those conditions for a while, but that risk factor stays there, and the chances of somebody with a severe mental illness like that committing suicide is quite a bit higher than the general population. It's almost 5 times higher. And so we really pay attention to that and really try to work with folks on building resiliency, building hope, and increasing protective factors.
And how are they treated?
We have a milieu that is 24/7 for some of our folks. So we have a day treatment program that does psychoeducational groups. We have therapy groups, one-on-one therapy. We have paraprofessional support day round. So we do a lot of different things. We try to get people out into the community to practice skills, to learn new skills, get them connected with their community. Do a little bit of everything.
Mental health conditions are one thing. Physical health conditions can also put people at risk. People who suffer with chronic pain or who have suffered a traumatic brain injury, for instance, that can be, I guess, as challenging to treat as these mental health conditions.
It is, my wife and I have a joint clinical practice. She's a physical therapist. So a lot of times when patients come in and they've got depression and anxiety and we're talking, sooner or later it comes out about their pain levels, back, neck, whatever. And as the pain levels go up, so does depression and anxiety. When you get the pain levels to come down, anxiety and depression comes down. And a lot of the patients that come in to see my wife especially, they make comments like, I don't know how much more I can go on.
Right.
I'm at the end of my rope, and that's when, it's like we can get these things under control.
I have a really good friend who's an optometrist, and we go out and educate people in the community, and she said, can you come in and educate my staff? And I thought, that's kind of weird. I don't know that I would think about an eye clinic, but she said, we have people that go into crisis because they lose their sight.
Sure.
And that's a major change and shift in somebody's life. So yeah, things like that you don't necessarily think about, but yes, they can be a risk factor.
Okay. We know environmental factors can also place people at risk, and we can take a look at some of those on our screen as well. We're talking about things like access to lethal means, things like firearms and drugs, prolonged stress, stressful events that happen in people's lives, and exposure to another person's death by suicide. When it comes to lethal means, talking about things like firearms and drugs, to safely manage that, I guess you want to try and keep people away from that, but that's something that's not easy to do, correct?
Correct.
Yeah, it's really not easy to do. One thing that the VA has been doing lately is to try to not necessarily restrict access all the time, but restrict access during that mental health crisis. And that's shown some pretty good results. Just anything that you can do to increase the time and the space from the acute suicidal thought to the actual picking up of the firearm, that the longer you can spend between those two things, the risk goes down.
The national average for suicide by firearm is 50%. Here in the state of Arkansas, it's 62%. We're over the national average. And it's a tough conversation to have in our state, but it's a super important one to have. And to kind of build on what you're talking about with our veteran population, one of the things that we've kind of gone out and educated people on is the importance of having just 3 people. Like 3 people that you feel very confident and close to, that if you're struggling, you can say, come make my environment safe. Take lethal means out of my environment, or remove them, or change the code to my firearm storage so I don't know it and I don't have access, to allow myself the time to get past that crisis point.
And that's a thing that takes a lot of trust between a person and whether it's family, friends, whoever it may be. Prolonged stress and stressful events. With these, I saw some examples. Classic risk factors: bullying, bad breakups, financial problems. What are the best ways to help people emerge from those things that so many of us do experience in our lives?
Yeah, a lot of that, we can be dealt with in a counseling session. But again, people don't want to seek the treatment because there's a stigma attached to it. And especially, we're seeing a large number of our high school and middle school students talking about suicide more because of bullying situations. And well, I should say this, even in our workforce, we're seeing adults talk about suicide because they're being bullied at work. And that's one reason we're really trying to get the message out for a stigma-free workplace. And this, we got to get along, we got to do this, we got to take care of each other.
Well, we're going to talk more about schools. I know NAMI has a program in schools, but speaking of the stigma, what is the best way to reduce stigmas around this topic?
I think it's just talking about it.
Yeah.
This today is helping us reduce the stigma. Talking and sharing our experiences and letting people know that they're not alone in that helps reduce the stigma.
We also mentioned exposure to another person's death by suicide. I suppose that could be a friend, it could be a family member, it could be a celebrity.
Correct. There
are a lot of ways that can intrude in a life.
Yeah, I think I'm sorry. Just having resources available. For instance, if that happened in a school, then the school would want to take time to pull crisis counselors in, or pull NAMI in, or pull other resources in to give the opportunity to the students to talk about that.
Yeah, postvention is critical. After a loss of someone, schools having some type of idea of what to do, next steps, and that even includes workplaces. And AFSP has several resources that we can give for free to help with postvention.
Okay. One other set of risk factors we want to go over are historical factors, and once again, we can put these on the screen. These include things like previous suicide attempts, a family history of suicide, and then childhood abuse, neglect, or trauma. These seem like some of the most challenging risk factors that would require the most intensive forms of intervention.
Yeah, for sure. There's the ACE study, I'm sure everybody's familiar with up here, their adverse childhood experiences. If you have 3 adverse childhood experiences or higher, you're at a higher risk for mental health issues, substance use issues, and suicide. So when those things happen to the child, I think it's important to get them into counseling or therapy, and then when they come and see you as an adult, then we try to work through some of those things, try to help somebody know that they are not those events, that they are a person that may have had those events, but that doesn't have to define their existence.
Right. For so many people, this starts early in life. Right?
Yes.
Okay, the warning signs. Jacqueline, most people who die by suicide exhibit warning signs. True or false?
True.
Yeah.
Yes, and some of them may be subtle. And some of them may be obvious. They may say things like, I feel like a burden, I feel overwhelmed, I don't know if I can continue any further, like Dr. Lackey said. We talk about talk, mood, and behavior are all things to pay attention to. So if someone's behavior has changed, I had a good friend that mentioned that she knew somebody that just was sleeping a lot, was not participating in family activities, had stopped going to work, was showing all these different things. And in my head, it was just a checklist of warning sign after warning sign after warning sign. And the next conversation was, I think that person needs to go in and get an assessment done. I think they're not okay. So yeah, there's absolutely warning signs.
But are they easily missed, and how are they overlooked?
Well, they're missed, but I wanted to add to what Jackie said just for a
please.
second. One of the things that I see a lot when parents are talking, whatever, is they find that their loved one is giving away their items.
Yes.
Okay.
And that's a huge, when
Yes.
you're starting, you got that prize, whatever, baseball or whatever, and you give it away, we need to pay attention to that.
To build a little further too, we tell people that if it's any behavior that's outside of the norm, that just seems off, then you need to ask, hey, what's going on? I've noticed these changes in you. What's going on? We also talk about that there are some people that display unexplained happiness. They just seem very, very, very happy. And that seems like an odd one, but that is one that is a warning sign.
Okay. We've talked about risk factors and warning signs. We want to discuss solutions as well. But before we do that, we do want to pause and take a look at how the Little Rock School District is taking some steps to address the well-being of both its students and its staff. Channel 7's Ryan Houston takes a look inside one unique and developing program.
It doesn't look like much now, but this half-painted room with buckets on the floor will be a place of zen for students and staff in the Little Rock School District.
Kids now, we're busy. We have a lot of things going on in mental health and protecting it and learning how to manage with your day, learning how to manage your emotions and your response is something that we want to make sure every student knows how to manage so that they can go out into the world and be okay.
Parkview High School senior Camille Gardner is talking about their new calming room. She says it's a place where students who are dealing with anxiety, depression, and other emotional challenges can refocus their energy. Students picked out the colors, plants, music, and many waterfalls that will help them exhale.
Yes, there's already a buzz of like, when can we use it, what's it for, and we're excited to share it when it's open and give kids the space that they need.
But what about the school staff?
Our focus is to make sure that we not only create a system where folks feel well and we're not creating workplace stress, but also normalizing and just helping people to be self-aware as it pertains to their well-being.
Crystal Green Braswell is spearheading the program, meeting with district stakeholders to find out exactly what's needed.
We're building it out, so it's pretty much we're building the plane as we fly it, but it will be based on 8 dimensions of wellness, and we're also looking through the lens of the school wellness wheel, and just making sure that we are on a journey to becoming a healing and resilience-centered organization.
I was Channel 7's Ryan Houston reporting for us today. For now, the district has 2 calming rooms. One is at Parkview and the other at Cloverdale School. I think we can all enjoy taking a moment to exhale at some point in our day. Dr. Lackey, NAMI has a program called NAMI on Campus. These are mental health awareness clubs on high school and college campuses. What's the idea behind those?
Yeah, so basically it's to end the stigma on campuses. That's the whole purpose of that. NAMI Arkansas 2 years ago got a grant through Blue Cross Blue Shield, Blue and You Foundation, and that kind of jump-started and allowed us to put 40 programs on 40 campuses. So we have them across the state in college and high schools, and basically, whenever they have their monthly meeting or whatever their meeting schedule is, students come together and they talk about mental health. They talk about ways to improve the stigma on their campus, and you know, when you put a group of 10th graders or 11th graders together, they can move mountains.
I bet.
And they do things that you and I could not do in districts. So we're glad to have them as part of the Army.
Lots of great ideas,
Yeah.
I'm sure, coming
Oh,
from
yeah.
those groups and fresh
Yeah.
perspectives.
Yeah, and in fact, this next year we're going to be pulling from those groups to create a student advisory board for NAMI.
We talk about the importance of early intervention, and I think that we automatically think about adults, but this is important, and it applies to children as well.
It does, yeah. So we go in and do Gizmo's Possum Mental Health Guide with third graders, but even I have a 4-year-old son, and I do things with him like, let's do some grounding techniques, let's do some breathing techniques, let's find ways that you can start learning how to problem solve. I think that's another we talk about protective factors. Problem-solving skills are really essential to that.
So as early as the 3rd grade, that's when these things are starting. One factor I understand about teenagers in particular is that sometimes you don't have long before a teenager will move from thoughts to action. So if you suspect a problem, again, it's important to act quickly.
For sure, I think teenagers, their brains are still developing, so they lack the foresight to think through decisions. They're very impulsive at times, and so this is especially good for thinking about removing firearms from the house or taking a safety plan. So yeah, there's a whole lot of training that can be done in schools to make those decisions.
And I think to build on that, one of the things that we keep hearing consistently is that a lot of kids are more willing to tell their peers than they are even a trusted adult. So it's really important that kids learn suicide prevention strategies and what to do if a friend tells you that they're struggling.
And we teach kids not to keep secrets.
Yep.
That's part of what we do in NAMI. Is, you know, if a friend comes up and starts talking and says you can't tell anybody, no, we're going to tell.
Yeah.
And it's not because we're a tattletale, it's because we're trying to help you. And that's what we're trying to get across to kids, that, well, not just kids, even adults, that it's sometimes it's not breaking their trust, or, you know, if they get mad at you in the end of it, well, I don't know what to tell you. They just get mad at you because you just helped save their life.
Right. Well, when you're dealing with younger patients, are their parents, are their families involved then in the treatment programs that will follow typically?
Most times they have family sessions and individual sessions. Yeah.
Okay. We know that mental health issues affect different groups in different ways. Let me ask you about veterans and the mental health issues that they face. Many, face the stress of combat, mental pain that can linger. How is it different to treat a veteran than maybe someone else in the general population?
Well, the veterans are, it's a hard category because I'm not a veteran.
Yeah, correct. Yeah.
So I can go to a certain limit with them, and then I don't understand what they've gone through or the branch they served in. So it's very important to have connections with veterans that have served or are serving, current military guys, that can be brought into the situation. There's lots of groups now. I know the VA has 4 or 5 suicide outreach staff. That's what they do. So if I call them, they respond, or they get on the phone with us, and try to help us walk through what it looks like to get this veteran to the VA or to any hospital. But they prefer us to get them to the VA, since we have, one of the largest locations here in Little Rock. So.
Yeah, I agree with that, and I think it's important to build community within that. We talk about AFSP that we want to educate people, but if it's talking to veterans, I'm not a veteran, so we want buy-in within those communities because it means more coming from somebody that has experience in that.
Marginalized and minority communities and also face a lot of obstacles. Access to care is a big problem there. How do we tackle that problem?
Well, I think that's the responsibility of advocacy groups and governments and all of us to create access, to create programs. There's church programs, there's nonprofit programs, there's community programs that can increase access to somebody to talk to.
I think it's also important to think about the cultural aspect around mental health for certain minority groups. We do a program called Talk Saves Lives, and we do a Spanish version of that. And the Latinx community came to us and said, hey, you're doing this wrong. You're not considering the cultural aspect of how we talk about suicide as a community. And so I think that's really important to make sure to pay attention to.
Right. For members of the LGBTQ plus community, rejection from families and friends, bullying, isolation, I know all those factors come into play and probably present a lot of challenges.
Yeah, I just saw we've been doing some work on bridging the gap for LGBTQ community to and mental health services. And we had some numbers that came through that just kind of blew my mind, because I was thinking, wow, you know, that 46% of the LGBTQ kids that think about suicide actually commit suicide.
Wow.
That's, you know, we got
big
that
number.
from NAMI National. And, you know, when I saw that, I was just getting ready to come on here, and I was just like, wow. It kind of struck me and just hit me hard that I didn't realize that big of a population is struggling with mental health, or just whatever they're struggling with, and that's what they're turning to.
So much work to do along those lines. So when it comes to what to do, I found a list of things. Having an honest conversation in private with a person is very important. Why is that so critical?
I think that it's a touchy subject. People are embarrassed to talk about their mental health, and that's part of the stigma. That's also part of being vulnerable. People don't really like to be vulnerable. So if you can remove distractions, if you can remove other people around and get them to a quiet place, they'll be more likely to be open and to actually tell you what's going on.
Jacqueline, you talked earlier about being direct. Ask them if they are thinking about suicide. You want to be that firm and that
direct. And you can say things like, you know, Chris, what you're talking about, the experiences that you're having right now, a lot of people that experience that, they think about suicide. Are you thinking about suicide? It needs to be a direct conversation, because if you ask, are you thinking about harming yourself has many different meanings. And so we want you to give the direct question.
Another one was to avoid debating the value of life, minimizing the problem, or giving advice. I thought that was interesting, because I think if I was talking to somebody, you have a lot to live for, but you want to stay away from that kind of
They don't see it that way.
Correct.
They're at the end of the rope. This is the way out. This is how they're going to end their emotional pain. They don't, you know, they're not looking at it that tomorrow's a new day and there's resources, and no matter what the problem is, we can get through this.
One of the things in our educating is that the brain has gone into crisis mode. So it's not thinking in the logical sense. So to debate somebody about life being worth living is not going to work. What you're wanting to do, and that's why I said you want to listen more than you talk, is you're wanting to give the brain time to kind of process out of that crisis point.
All right. Assume you're the only one who will reach out to a person. That's a lot of responsibility to take on. But I guess when you're talking about someone's life, it's an important responsibility to take on.
Absolutely.
Yeah, I agree.
And I think it's just saying, you know, again, hey, I've noticed these changes in you. This seems off. Are you okay? What's going on? And there's a Seize the Awkward campaign that is Ad Council does it, the Jed Foundation. It's excellent, but it's all about saying, like, I'm here to talk if you ever need to.
Staying with someone and following up with them, that's also
Yep.
very important. You don't want to leave someone to their own devices.
Right. You don't want to ask the question and get the answer and then walk away.
Yeah.
You want to ask the question and get the answer and then stay with them until you can find help. You can call the 988 hotline together. You can drive them to the hospital. You can take them to the mental health center. Leaving somebody alone is not gonna help as much as we might want it to. But asking the question and following up, that gives them time to think, that gives them time to process, and it also gives them the opportunity for help.
I think it's important too to make sure that you know if they say yes, what your next steps are, but also if they say no. You know, have a plan. Keep talking about it. You know, if they say no, it's not like job's done, see you later. We need to kind of come up with a plan for next time.
And I think also, remember, you can call your local law enforcement and they'll come out, and we have trained officers across the state in crisis intervention that's been trained to deal with mental health and suicidal persons. so that they understand how to talk to these people. They understand what to do, and they also have the power by the law to help them get to the ER or treatment center. And a lot of times we don't want to involve law enforcement, but when you have a crisis intervention officer, a CIT officer, that's the specialist right now. And when we train them, we tell them, you are the mental health specialist at that moment. And you have to make decisions sometimes for the person.
And if you don't want to call 911, you call that 988 number. And so when they do tell you, yes, I need the help, is that the move then to call that number, for instance?
That's what we tell individuals to do, and you can call on behalf of somebody. In fact, most of the calls that come into our 988 center are from loved ones supporting somebody. And it's a trained crisis intervention counselor that will walk you through what to do. So that's important to know. But if it is a suicide attempt in progress, that's 911. That's a medical emergency.
Right. For the people who are the people struggling, the importance of them knowing that they need to seek help and that they need to tell someone about how they're feeling. How urgent is that?
I think it's very urgent. If you're going through a struggle like that, then find somebody to talk to. It can be a family, it can be a friend, it can be a professional, it can be a chaplain, a pastor, a teacher. And I think that goes back to part of what Jacqueline's been talking about with all the campaigns, is teaching everybody how to respond when someone comes to you and says that they're thinking about harming or killing themselves. We have to know how to react and react the right way, and then help them to find help.
And I saw that people should treat themselves like they would want to treat someone who needs their help as well. That's good advice. Well, we talked about risk factors. Let's talk one final thing we can put up on camera. These are protective factors. Things like having access to mental health care and being proactive, feeling connected to family and community, developing problem solving and coping skills, limiting access, as we mentioned earlier, to lethal means, creating a sense of purpose and self-esteem. These are all things that can kind of build up people's safety net, so if they are in a struggle, there's a way out.
Yeah. I think sometimes when you're in the middle of the storm, you're not thinking about any of those things. So it takes the outside person to bring those in and help you realize that those protective factors are things that we have to look forward to.
And then once you're through the crisis, you want to continue to build up those protective factors. Find community, find people to check in with you, find enjoyable hobbies and activities and school and all those things as well.
I know that in the past, the approach was to treat an underlying condition like depression, and then the thought was that the suicidal thoughts would go away. Now suicidal thoughts are also treated as another condition, correct?
Well, we do treat them, but it usually runs with that depression or schizophrenia, bipolar. We find that often in those. But we do, when someone says they're suicidal, we bring them into the clinic, but we also treat them the depression and treating the anxiety, whatever else is going along with that.
Okay, a holistic approach. If anyone wants to reach out to the three of you or your organizations, give us the best way to do that.
You can just call the NAMI office at 501-661-1548.
Okay.
And you can look up AFSP Arkansas at afsp.org/Arkansas.
And Birch Tree Communities, you can get us at birchtree.org or 501-315-3344.
Okay, I know the NAMI Arkansas 5K Walk to End the Stigma is also approaching.
Yep, October 7th, and it's going to be down off of Crystal Hill Road there by Crystal Hill Elementary School.
Okay.
It was in Burns Park, but since the tornado, we've had to move it.
All right,
Yeah.
okay.
So we moved it.
So 5001 North Shore Drive
Yes.
in North Little Rock was the address we have. Any promotions from your organizations to promote or events upcoming?
Sure. So we've got our Out of the Darkness Little Rock Walk that's happening on October 29th. That's a Sunday. And registration will open at 12:30, War Memorial Golf Course. Please join us.
Okay, sounds terrific.
And we're going to be a part of the suicide walk, or the mental health walk, and then we do a really great art show once a year, so you can get us on our Facebook page and get more details on that.
And that Facebook page is?
That's You just search Birch Tree Communities on Facebook and you should find it.
Okay, fantastic. Well, hey, before we go, one more reminder that if you or a loved one is in crisis, you can call, text, or chat with the Suicide and Crisis Lifeline at 988, or contact the Crisis Text Line by texting TALK to 741-741. We do have all this information on our website, KATV.com. And keep in mind, the 988 Lifeline does have options specifically for veterans and members of the LGBTQ plus community. Well, our thanks to Jacqueline Sharp, the Area Director for the American Foundation for Suicide Prevention, Buster Lackey, the Executive Director, of the Arkansas branch of the National Alliance on Mental Illness, and Dr. Chris Jackson, the Branch Director for the nonprofit Birch Tree Communities. Thanks so much. Make sure to like this program and subscribe to the KATV YouTube channel for more original content just like this. I'm Chris May. Thanks for watching.